Appropriate therapy. All patients should receive potassium iodide to prevent thyroid damage, which is released by radioactive iodine released during the explosion. Decontamination. Protection is important while considering treatment for victims of radiation exposure. Strict isolation precautions and adequate personal protective gear is essential. Decontamination begins with the victim removing, sealing, and labeling all clothing for isolation. All victims should cleanse the skin with mild soap and thoroughly rinse with water. Wounds on injured patients should also be irrigated with normal saline, then proceeded with standard decontamination techniques. GI syndrome should be treated with aggressive hydration and IV antibiotics to combat hypovolemia and sepsis. Treatment for the hematologic syndrome targets the initial symptoms of nausea and vomiting, followed 2 weeks later by blood product replacement and colony-stimulating factors to compensate for neutropenia, thrombocytopenia, and lymphopenia. Patients with CNS syndrome should receive good palliative care as the syndrome is fatal. Thermal injuries should be evaluated as normal burns are evaluated, and the patient should receive supportive care with a patent airway, fluids, and whole blood as needed. Patients who have received whole body radiations should be managed as acute radiation syndrome in the prodromal period until it can be determined which type of radiation syndrome that they have. They should receive adequate supported care. Infection management is very important among these patients as many develop neutropenia. Minimizing catheters, wound debridement, dressings, and antibiotics are essential to reduce infections. Initial coverage should be with penicillins and aminoglycosides. For blast or traumatic injuries, treat for hemorrhage, fluids resuscitate as needed with blood products, and provide surgical interventions as needed. Many patients will require psychological support. Always give reassurance and positive reinforcement. Allow the patient to express their fear and anxiety of the situation, and ensure that there is adequate communication. Long-term evaluation for the development of PTSD is warranted, as many victims of nuclear warfare as well as witnesses do develop the syndrome.